Hi, I'm Mary Kate, and today's video task is performing basic first aid on a pet that is in shock. So I have a client that has brought her pet in that has been attacked by some dogs. So she is currently kind of in a dazed state. She's awake, but she's not really responsive to me touching her or anything, cannot really hear what's going on. So we are going to assess her vitals if we can. I'm going to get a temperature, a pulse, and a respiration. I'll check her mucous membranes, see if they're tacky, what color they are. Normal pink is a good sign. If they are cyanotic, blue, very pale, white, she could be losing a lot of blood, anything like that would give me indications as to why she's in shock, and we need to address those immediately. Check her capillary refill time, her CRT, see if it's greater than 2 seconds. Less than 2 seconds is ideal, so we want to make sure that all of her vitals are normal, and if something's wrong, to address it as quickly as possible. If her temperature is cold, then we want to put a blanket on her. Sorry, Miss Sadie. So I can try and put a heated blanket on her, or maybe a heating pad that is under a towel, just so it's not going to burn the patient. Just try and bring her temperature up. If we can, I want to assess breathing, make sure there's nothing blocking her airway, make sure that her head is level with the rest of her body, just to prevent anything. You don't want her head flopping off the table or anything, so make sure that it's level. If we can, we'd like to get catheters placed in the pets that could potentially be in shock, whether it's cephalic or saphenous, whichever vein we can access the best to get intravenous fluids going through to help them bring them out of shock. We want to keep the pet as calm as possible, potentially put them in a room that's quiet, dim the lights or anything, just to keep them calm so they don't come up in a panic mode or anything. Notify my veterinarian of the current situation, let them know we have a pet that is in shock so they can get to this patient as quickly as possible to help bring them out. And if the patient were more alert to me touching her, anything in certain areas that were painful, if she tried to bite, we definitely want to make sure that we're muzzled so she doesn't further injure herself and we don't get bitten in the process. But for video's sake, this is a patient that is pretty dazed and out of it, so no muzzle is required. But that is my video on basic first aid for a patient in shock. Thank you.